Today we have lovely Stephanie. You may have met Stephanie. She's one of our skin therapists. She does a lot of the microneedling, radio frequency, some of the skin tightening and skin peels in our overall medical skincare. So Stephanie's been with us a little while and we are doing some work for Stephanie today. So Stephanie, what are your concerns?
So first of all, my cheeks, I feel that they have deflated over the years. I did lose a lot of weight when I was younger, so I think that might be due to that. I also have noticed that I prefer a stronger jawline, especially on my left side. I find that I take all my photos on my right side, so I'm just kind of looking to profile balance today.
So your right side's your stronger side, it's
Yeah.
the side that you're happier with.
Yeah.
You want to work on your left side as well. We're going to get a bit of balance. So what I've heard is that your cheeks have lost a little bit of volume. You've got these lines from your nose to mouth, and while they're characteristically, they're a little bit deeper than they used to be. And there's also your chin and your jawline.
Yeah.
Now, when I come to talk about jawlines, I often split it into different components. I talk about the corner of the jaw, the side of the jaw, and the chin. And in this case, the one that's going to make the most benefit is the chin. And here at Dr. Aesthetica, we like to do things with the least amount of products required and the least change, because we want to keep it as natural as possible. So we're going to be working on her chin predominantly and a bit of the mid-face to rejuvenate those fat pads that have been lost over the years. So we're going to do a mixture of techniques today. We're going to do a mixture of needlework and cannula work. It's going to be a lovely, interesting procedure, and we'll get started. So now we're just sterilising the skin. So we're using a clinical product just to get the skin nice and clean. So with this, we're going to be using a cannula at this point. So a cannula is a long tracked tube that we can use under the skin. To initially start that, we need to make an introductory hole. So we're just going to do a small little insertion point with the needle, and we're just going to do that here, and that will allow me to access this part of her cheek here, this part of the cheek, and work down here from a single entry point. So it's a convenient way of doing lots of treatments in one way without lots of downtime. So Stephanie, we're going to get started. You're going to feel a sharp scratch coming to the cheek point just here. It is a little bit pinchy. It does hurt a little bit, but it'll be nice and quick. Okay, so I'm just going to work you backwards. So I'll count you backwards. So 3, 2, 1, and that's in, and that's out. On a scale of 1 to 10, you've had your lips done. How was that in comparison?
Probably like a 6.
So it's decent pain,
Yeah.
but it is quite weird.
Different.
Yeah.
I've never had it before, so I didn't know what to expect.
So the next part is a cannula. The cannula is this long tube here. It's got a little bit of an opening on one side where the filler actually comes out. So if you look carefully, I'm just going to be pressing it ever so gently. Small amount of dermal filler just coming through. And that goes so far. Just numb the area a little bit, make it a little bit more comfortable. Okay. A little bit of bleeding is expected. It is a needle that's gone through the skin, so I'm expecting a little bit of redness. A little bit tighter here. So, one of the benefits is that Stephanie's already had some skin tightening to tighten up her skin. Great way of boosting up her collagen prior to any dermal filler treatment. It means the amount of product we need is less. Nice deep breath, Stephanie. It is going to be a little bit tender. And we've done all this without numbing so far. So in this case, we're going to give Stephanie a lovely arch coming up across the cheek, but a very natural cheekbone bone contour. I'm not looking to overdo it. I don't like alien cheeks, but just a small amount to give that lovely lift. It's important here to always assess for the temples and see if any temples need doing at the same time. Looking lovely. Good. Smile for me again. You see the cheek positions are quite different already. Sharp scratch. 3, 2, 1. Oh.
It does crunch, don't it?
It's going through all the different layers of the skin. Now we also know that her left side is slightly more deflated. It's the side that she sleeps on, so we're just going to do a little bit more work on this side to get some symmetry. So we're just now working on the chin. So with this part of the chin, what we want to do is create some forward extension and some downward extension. We're going to actually work around 45 degrees. We want to elongate her face and give it a profile. Now we've noticed there's an area of weakness just in the pre-jowl on both sides, along with the chin. So the first component is going to be to improve the chin. The second component will be to structure the pre-jowl in order so it matches with her jawline. So we're going to start by doing some central work here, slowly building up the chin. It is with needle, so there is a little bit more downtime. I often say that this is a common area for bruising, around 10%, and any of these injections carry that risk. That's it. So we're doing nose to mouth filler. So nose to mouth, and then often the other area is mouth to chin. So anywhere down here. This is outside of the cheek, this is central cheek. So it all depends on each patient what we're trying to do. In Stephanie, we've done a bit of both central cheek and outside cheek. We've done the central cheek, we've done the pre-jowl. Now we're just doing a little bit of softening just here to bring it all together, and that will give us the final finished piece. Hello.
Sorry.